Hi, my name is Jacob Green, and I'm here to talk about needle decompression. But before we get into the technique of needle decompression, we're going to talk about attention pneumothorax. Basically, attention pneumothorax is a collapsed lung that's causing air pressure and gas pressure to build up within your thoracic cavity. So say we have a left-sided lung collapse from a penetrating chest wound or a blunt force trauma. Those are kind of those two, or at times you can have a spontaneous pneumothorax, which that is very rare, but it can happen. Some of the signs and symptoms of attention pneumothorax are going to be hyperresonance in the chest. So you're going to have, say this, it's a left-sided collapse. You're going to have very firm feel to the chest. This is going to be your kind of softer, still muscle tissue, adipose tissue, still going to feel soft. But this left side is going to be very hard and almost snare drum-like when you're palpating it. Second, you're going to see unequal chest rise and fall. So again, I have no air moving to this left side, so all the air is moving to the right side. So you're going to see that right side moving up and down. This left side is going to stay fairly put. Then, very, very late sign, you can see tracheal deviation. So again, the left-sided collapse. You're going to see that trachea deviate to the right because air is going to want to move in the path of least resistance here. And also, you'll note some trachea or some JVD or jugular vein distension. So those are kind of signs and symptoms of attention pneumothorax and kind of what it can cause. And now I'm going to kind of want to go into how to do a needle decompression. So a needle decompression is a 14 gauge or 16 gauge needle, roughly about 3.25 inches long. Now this is to get through all that muscle tissue, adipose tissue, and get into that pleural cavity so that you can actually get air to come and escape out of the lung. Now, you have to be very careful when doing a procedure like this because, again, you have a lot of veins and arteries that move through your chest cavity here, and if you were to puncture one of those, or say you were to puncture the heart, you have a whole other patient and you have a whole other mess of problems to deal with. And if you say you puncture an artery while you're trying to do your decompression, you can cause a hemothorax, which is a buildup of blood instead of air pressure within that thoracic cavity. So, to find a correct space to do the needle decompression, you're going to want to find a clavicle on the side that you're working on here. So I got my clavicle, which is again this bone right here in the top of your shoulder here. You're going to come down to your sternum and kind of palpate down till you feel that third rib. Once you find that third rib, you want to go to your mid-auxiliary line. So that's going to be about your nipple line, right about here. So you'll palpate over, you'll find that third rib, you'll move over to that mid-auxiliary line, and you'll come right above that space. And once you're above that space, again, you're going to want to use your antiseptic wipe. You're going to want to clean that area really well. Make sure that you're minimizing the risk for infection. Because again, we're not trying to make the patient worse, the outcome worse. We're trying to make them better. So once we've found that second intercostal space where you don't run as higher of a risk of hitting arteries and veins, you still might. But again, in the case of attention pneumothorax, you kind of got to play the odds and go for it. So once you've found that space and you've got the area nice and cleaned, you're going to want to take your decompression needle out. And again, this would normally be hooked up to a syringe, but for transparency's sake, I just have a needle and I'm not going to puncture the dung. So I found my space, I've located my second intercostal space, I've cleaned my area very well, and we're going to go perpendicular, so straight down into the chest. You don't want to come at it at an angle because, you don't want to puncture your heart. That is one of the last things that you want to do. So you're going to come perpendicular, straight down, all the way to the end of the catheter here. Insert it all the way down into the patient. Once you've done that, you should be able to hear gas release. Now, you could be back in the back of the ambulance, and you're moving right along, or you're in emergency transport, and you're not going to be able to hear that. So again, one of the best ways to see if you had positive gas release is to, again, auscultate your lung fields. You're going to start seeing equal rise and fall of the chest, and you're going to see the patient's trachea even start to slowly move back over. So from there, once you've waited about 5 seconds, you're going to want to remove this needle from the catheter. And the reason you want to keep that in there at first is because, say that muscle tissue contracts and it starts to push that catheter closed, you're not going to get any gas escape. So you're going to leave that in for a few seconds, make sure you hear that positive pressure come back out, and you're going to remove that needle. Now once you remove that needle, you're going to want to take your gauze that you have on hand, and you're going to make it like a bulky dressing, just again like if you have a penetrating wound somewhere, how you don't want to remove that object. You want to place items around it, tape it down really well, and make sure it stays in place. Once you've done that, you've kind of successfully reinflated that lung, and then you're going to continue to ventilate your patient. So from there on out, you've successfully done a needle decompression, and I hope this video has been educational for you, and a happy holiday to you and yours.